The glenohumeral joint, also known as the shoulder, is the most mobile joint in the body and allows us to complete a wide range of movements, such as abduction, adduction, flexion, extension, internal and external rotation, as well as circumduction. Adduction is when the movement of the limb is towards the body, and abduction is when the movement of the limb is moving away from the body. Flexion is a decrease in angle between two bones, and extension is an increase in angle between two bones. Internal rotation is the movement of the anterior surface of the limb towards the midline of the body, and external rotation is the movement of the limb away from the midline. Circumduction is a circular movement of a body part. All of these movements occur on the sagittal plane, which separates the body into right and left compartments. The shoulder is made up of three bones: the humerus, which is the upper arm bone, clavicle, which is the collarbone, and the scapula, which is also known as the shoulder blade. If you look closely at the diagram, you will see something labeled as the bursa, which is between the rotator cuff and the acromion. The bursa allows the rotator cuff tendons to glide freely. Also, the surfaces at which the ball and socket meet are covered with smooth, elastic cartilage that absorbs shock and allows the joint to move easily. The shoulder is kept in the socket by the rotator cuff. The rotator cuff consists of four muscles that come together as tendons to form a covering around the head of the humerus. The four muscles are the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. Because the socket of the shoulder is shallow, the joint relies on surrounding soft tissues to support it and hold the components in place. The soft tissues that surround the joint are lined with a thin membrane called the synovium. The synovium is responsible for providing synovial fluid to cushion and lubricate the joint. Some other key structures of the shoulder joint include Some other important structures of the shoulder include the labrum, which is a fibrous ring of cartilage that surrounds the glenoid or the shoulder socket to create a deeper socket for the ball to stabilize the joint. Another structure is the rotator cuff, as I mentioned before, which is a network of four muscles and tendons that cover up the top of the humerus and hold it in place and enable the arm to rotate. Next is the deltoid, which is the largest and strongest muscle of the shoulder. The deltoid muscle provides the strength to lift the arm. A complete rotator cuff tear occurs when a tendon is detached from the head of the humerus. A partial tear involves the tendon, but it is not completely torn. Symptoms of rotator cuff tears include pain and tenderness in the shoulder, pain when sleeping on the affected side, and pain while elevating. Sometimes tears can be without symptoms, so if you feel any pain, it's important to see a doctor right away. treat your tear, you might have to undergo surgery. This is only if there's complete tear and if you notice chronic symptoms. You could also do platelet-rich plasma and physical therapy.